Today
This
we will
conference
start
will now be recorded.
early pregnancy. But yesterday when I prepared for early pregnancy, I found that do you accept that daily one module, or you want us to take from the module as much as we can? Because February is around 1.5 months, and most of the cases it comes in the exam. So do you want to expand it, for example, 2 to 3 days until we finish the module, or you want us to take daily a module? Because yesterday I found some cases in the Eurogynae, which is also important to be discussed in more depth. And what do you think about it? So it's okay for you to take daily one module, or we try to finish the module as the 3 cases we take lots of. What do you prefer?
Ma'am, how about paper-wise? Like
To
doing
finish, let us
sure,
do
sure.
Just
by module wise.
Yeah,
Module wise.
module. Yeah, so we take
Yeah,
cases
yeah,
from
yeah.
each module as much as, so we can take, for example, Eurogynae 2 days, we finish them, and after that early pregnancy 2 days, we finish them, and so on. Is it because I don't think so? It is not for example, maternal medicine to take 3 cases only, and we lift it. So I prefer to take as much as we can from the cases to discuss this together, especially these cases. Most of these cases are from recent exams, similar to them at least. So I think we prefer to expand the module. For example, early pregnancy 2 days at least, and Eurogyno 2 days at least. That's okay for you?
Yes, yes, that will be
Yeah,
better.
okay.
Okay. So we will start today the early pregnancy. And Sumaira, are you here?
Yes, doctor, I'm here.
Are you ready?
Yes.
Okay, fine. Start with the first case. Yes, this is 2 minutes to you. Okay.
Okay. Hi, I'm Dr. Samara, one of the doctor in the emergency today. May I confirm your name and age, please?
I'm Helen Brown, 34 years old.
Okay. How would you like to be addressed?
Helen, please.
Okay. Helen, I can see that you are having a pain and you are 8 weeks pregnant.
Yeah.
Can you tell me about your condition now?
Can you tell me about what?
Uh, can you tell me about your condition?
Yeah, it is planned pregnancy, and I'm happy for these. But what happened? 2-3 days ago, I feel that I have abdominal discomfort and with a bit with a vaginal bleeding, sometimes spotting.
Hmm.
Um, I'm not really happy because of these,
Okay, how's
especially
pain right now?
especially because I have I have many times that I had abortion and miscarriage, and I'm not happy about these.
Okay, really sorry to hear about this, and I can see that you are so much worried. I will try to help you as much as possible. Uh, are you comfortable to talk, or you want some pain relieving medication?
No, no, I take the nurse gave me some paracetamol, and I'm okay now.
Okay, so Helen, what I'm gonna do now, I will ask some couple of questions regarding your health, and then I will discuss your ultrasound reports and further. All right.
Yeah,
So,
okay.
uh, is this pregnancy is conceived naturally?
Uh, Sumera, your voice is not clear very well. So can
Okay.
you please repeat the question?
Okay. Is this pregnancy conceived naturally?
Yeah,
Okay. And can you tell me about your pain? How severe pain it is?
it is like a discomfort. Sometimes I feel it's increase, and I can't be sleep at night. But
Okay.
today, it is discomforting me, and I'm worried about it's it start to be severe that I can't just even sit down.
Okay. Any shoulder tip pain?
No,
How's your bowel works?
it's okay.
How's your water works?
Okay.
Okay. Have you used folic acid in this pregnancy?
Yeah, I start 2 months before this pregnancy.
All right. And I want to ask some couple of questions regarding your sexual health. Have you ever suffered from sexually shared infection?
No,
All right. And any vaginal discharge?
no. Just
Okay.
as I told you a little, sometime I found a brownish discolor,
Yeah.
brownish discharge, and
Mhm.
sometime blood spots only.
Okay. And along with this pain, have you ever faint in these duration?
No, but just I want to mention, yesterday I have a vomit from the pain.
All right. Okay. Um, are you up to date with your cervical screening?
Yeah,
Okay. I can see that you have one baby with you and you have three miscarriages. So, and you have been investigated, but no cause find out. But can you tell me that these miscarriages, how you have treated with the medicines or you have gone through by the surgery?
no, in reality, one of them because it's around 3 months and others, so I have a heavy
Mhm.
bleeding in it, and they end with the surgery. But otherwise, all of them I take a tablet, and after that's everything finished.
Okay. And any medical condition for which you are following GP?
No,
Are you allergic to any medicine or substance?
no.
Do you know your blood group?
Yes, it's B negative.
Okay. Have you received the anti-D injections after all pregnancy?
Yeah, yeah.
Okay. Any reservation for blood transfusion?
No,
Okay. Have you ever gone through surgery in your tummy or down below?
no,
Okay. Do you smoke?
no.
Okay. And what contraception you are using?
Um, I told you because it's a planned pregnancy, and I want to become a pregnant. So,
Yeah,
in reality,
but
in the last
before, have
few
you
months,
tried?
what I used before, but before that, I use UCT.
All right. Okay.
Yeah, loop. It
So,
was the loop inside.
yeah, what do you do for living? Uh,
I'm a teacher.
okay. Are you with someone right now?
Yeah, with my husband. I have one baby
Okay.
from him.
Yeah. Okay. So, are you aware of your height and weight ratio, Helen?
Are you what?
Aware of your height and weight ratio.
Yeah, it's normal. I think it's 24, something like that.
Okay. Thank you for sharing the information, Helen. I would like to examine you. After your permission, my nurse will check your blood pressure, pulse, and I want to palpate your tummy and see the bleeding from the down. Okay, now let's move on to your
Yes.
result. Yeah,
Thank you.
I have your blood test and ultrasound report. As I confirm, it's your by checking the name and the NHS number, and I'm gonna share with you. I can see that you are all alone. You want to call your partner or someone with you?
No, he's not here. And really,
If
he's
you
busy in
want
his
my
work.
nurse
But,
can
why you want him? Is there something serious?
if you want my nurse can accompany you.
No, never mind. It's okay for
It's
me.
okay. Okay. Sarah, sorry, Helen, I'm afraid that I have some concerning news. According
Mm,
to your scan, you are having an ectopic pregnancy.
ectopic.
Have
What
you heard
that mean?
about it?
Yeah, no. What's exactly?
Okay,
What's
let
what's
me explain. Yeah, let me explain it to you in simple language. Normally, when the egg and the sperm meet up in the tube, they are coming down in the womb and attach there and continue as a pregnancy. But in some of the cases, they meet up in the tube and attach there and continue pregnancy in the tube. So any pregnancy outside the womb is abnormal, and we are calling it ectopic pregnancy.
yeah?
As as this pregnancy is in the tube, and tube is very delicate structure having no flexibility there. So if this pregnancy will grow, it can rupture the tube and it can be life threatening for you. So we need to take some measures to stop growth of this pregnancy.
And is it
Yeah,
is it is it? Oh, that's mean I can't. That mean
I'm
this
really
pregnancy
sorry.
also. I will lose this pregnancy also.
Yeah, I'm really sorry that I can bring this news. Yes, as this is not a normal position and you cannot carry on. It can be life threatening for you.
Oh, so what can I do
How
now? Oh, it's
Yes, how it happened, it can be due to infection of the tubes, any previous surgery. That can be any reason you previous cleaning of the womb after abortion or use of a coil can be any reason. So what I can offer you now, we have a couple of options, Helen.
yes.
Expectant management, it means wait and watch. We can follow you by the hormonal treatment. We have couple of options. We have expectant management, wait and watch, that is not suitable for you. The other two options we have a medical management and a surgical management. So for medical management, let me discuss with you one by one. For medical management, we have a hormone, which we injection. We have a medicine injection which we will give you and we will follow after 2 days by a test of your hormone that shows that either it's growing or not. But for that, you need to follow us up very closely. How far you are living from hospital?
And maybe 15 minutes by car or
You have transport facility.
yeah.
So that's nice. You can choose this option also, but it's not compulsory that you will be succeeded. Yes, there is a success chances there around 70 to 80%, but still out of 7 out of 100 patient need a surgery as it will not be successful. All right, the other option is the surgery, which will be in a uh, general anesthesia. We will admit you. If you are in a stable condition as you are right now, you can go for a keyhole surgery, and in that surgery we will remove your tube where your pregnancy is there, means your right tube. And
Mm.
then, yes, it's a surgery, so there are some risk of bleeding, pain, and but for that we will take care. We will senior consultant will do the surgery. We will take care of the. We will give you medicines to avoid the infections, and your pregnancy test we will do after the surgery. 3 weeks after that to follow that this pregnancy tissue has been subsided from your tube.
Mm.
Anything you want to ask? Hello.
Okay. Yes, yes. I'm follow you. I'm follow you. Don't worry. So continue. And so I must take, in your opinion, the medicine is better.
Yeah, we have an option of medicine also. And for that, we will keep you in a close follow-up. I will give you one injection and I will send you back home if you are comfortable. And after 2 days, we will follow your hormone test. But if any time you are having pain, bleeding, fainting, you can immediately inform us. At that time, there is a risk that your tube, your pregnant, this injection is basically stopping the growth of the pregnancy. But if it not work, then there is a risk of surgery is there. So at that time, we may end up in emergency surgery.
Okay. Now, thank you because you are more than 2.5
Yeah.
minutes more after
Yeah.
the 10. Um, uh, Thank you for everything. You are covered most of the points. Otherwise, that you are expended. I think that everything is little bit. It's okay, but we will discuss some points I want to mention. First of all, the introduction was good. The history is a little bit prolonged. 5 minutes. It's better to be 3 to 4 minutes. 4 minutes is accepted because the patient in pain, so he will be slow emotion when he replying you. Um, you understand that, so it's okay for 4 to 4.5 minutes, 4 minutes. But after that, when you feel that the history take from you a long time, in the online you will see the minutes in front of you, not like the face to face. In the online, the minutes in front of you, so you can realize how minutes you take in the history. So when you find something like that, try to be faster and faster in the explanation, in the management, and other points. So the history take you cover the history, but it take long time from you. The examination is fine. And the results of the blood test and how you explain it and the breaking bad news you give it to the patient also, it's fine, it's okay. Now, the management, because when you asked me in the history what is your blood group, it was B negative. So I think you must mention NTD here in this. This is when you missed this. The management by itself. Look at to see the symptoms you ask about it, and the risk factor also, because she has previously surgery in the miscarriage, maybe this is the real cause behind these and others. Okay, so the explanation you take it, breaking bad news, and you explain the ectopic pregnancy. It's very brilliant. Now what you need for the investigation, because here it's a present beta hcg once, so you can repeat it after 48 hours, even so that the uterus is empty. With the beta HCG like that, it's most susceptible. This is ectopic pregnancy. So this patient need management. The first thing for the management, you must admit her to the hospital. This patient not must go to the home anymore, because at any time she will faint. Anytime there is a rupture, there's a suspicion of ectopic pregnancy. So once you realize something, that you must finalize your investigation or your management in a hospital, whether medication, whether surgical. So this point is important. Admission, you must admit this patient directly. Okay, and don't forget the NTD. NTD, most of the whether molar pregnancy, whether ectopic pregnancy, most of the cases in the exam come with the negative RH. So don't forget the beta HCG. Brilliant to ask about blood transfusion and if there is any objection for a blood transfusion. This is also important because most of the Jehovah Witness and others also come with this condition or with the placenta previa. Any bleeding situation, you may found Jehovah Witness. So blood group and blood transfusion questions very important. The management for the ectopic pregnancy in general, whether you must mention the three. You must tell her whether conservative, observation and only, but this is not work with you because you have symptoms and the blood pregnancy titer is a little bit high. The scan also revealed that there is no gestational sac inside the uterus, so it is mostly ectopic pregnancy. Okay, so you mentioned too whether medical, which is fine. Yes, methotrexate. The methotrexate, you tell her we admit you to the hospital and you will take as soon as possible methotrexate. But also brilliant to ask her if she can follow up on day 4 and day 7, because if she can't follow, you can give her methotrexate, as if the beta HCG in these 2 days doesn't reduce, so 15% of need for the second dose and 7% need for surgery. And how do you choose between the second dose and the surgery? Before you give the second dose, and if you didn't see the beta HCG is in the appropriate level, so you must do another scan before you give the second dose. If the fetal heart is positive, so the surgery is indicated in this case. And if the patient is deteriorated, the surgery is indicated in this case. Okay. Also, for a patient safety, you didn't mention that if she take a methotrexate, she must be 3 months with a suitable contraception. She can't be pregnant again in these 3 months because she take methotrexate. So this is the important point for the methotrexate. Other than that, before you give her the methotrexate, she must do some investigation such as kidney function test, liver function test, and as I told you, 3 month contraception. This is for patient safety important points. Regarding the surgery by itself, the surgery it is considered the first line if the patient cannot follow up for the medical, if the patient is hemodynamically unstable, if the patient has a pain, if the sac is a little bit big, so you must give her surgery. The surgery, whether laparoscopy, open keyhole surgery, or laparotomy, isn't it? Yes. So if laparoscopy by itself, if laparoscopy, so the patient, you must tell her the keyhole surgery is better than the laparotomy because it is short time stay in a hospital, less amount of bleeding, and you can return to your daily life more quickly. However, regarding the surgery time by itself, it's according about her also birth wishes, because we want her birth wishes and also the healthiness of the tube by itself. If both of the tube is healthy, so we prefer to remove the tube, the affected tube, and we will do a pregnancy test after 3 weeks. However, if the other tube is unhealthy, such as there is hydrosalpinx, oedematous, or is you feel it blocked, or anything make these tube not working properly, so we prefer not to. You must discuss this with the patient. We prefer not to remove the tube, and we will do an open in the tube to remove the sac. This is to protect the tube, and protect her fertility as well. Okay, so when you mention this point, also you must mention that there is some risk that the pregnancy is continue. So we need to do a follow up weekly for the beta HCG, and there is a failure rate that we need to another surgery to this patient and remove the tube just in case if the patient is fainting, if the pregnancy is continue, so need to remove the tube. The patient must know about all these. Other than that, the complication of the keyhole surgery, you must mention it: the bleeding, the infection, the injury to the bowel, and other. Whenever you say laparoscopic or keyhole surgery, you must mention the bleeding, the infection, and injury to the other. Uh, and okay, so do you have any other point you want to mention here? Any one of you? Okay, so who wants second?
Uh, Ma'am, hello, ma'am. I have a query.
Yes,
Ma'am, can I go ahead?
yes, yes.
Ma'am, in this scenario, the ultrasound report is not showing the size of the gestational sac or the mass. So, can we say to the patient that we would need some additional information to decide on what to plan next? Then we
Yeah,
can
you can say,
obviously
I want
explain
to
her
take
all
a
the
look
options.
about your notes.
Yes.
In the exam he will
Okay.
give you
Okay.
this in the exam he will give you the ultrasound report full of everything you want to mention these.
Okay.
However, if you find it missed, so you can tell her, I will take a
Yes.
look, because there is no scan like these, but we give it as a hint because I don't want to write more. But in the exam he will give you
Oh,
the
yes,
uterus
ma'am.
is anteverted with a size like this, the endometrium like this, and there is no gestational sac inside it. Okay, and he may mention
Okay,
that there
ma'am.
is
Okay,
an,
ma'am.
but whatever you see echogenic mass, this is in the tube, this is probably it is an ectopic pregnancy. And here the beta SCG is a little bit high. This is, goes with the methotrexate mostly, or the patient is in pain, there's vaginal bleeding, however she's hemodynamically stable still, she can talk, she can
Yes.
manage everything. So in the exam, it will not come like these ultrasound. It come, the investigation may be one paper, but when you see something like that, don't read everything. Just read the most important point and go to the conclusion at the end. You will find a conclusion that give you the
Okay, ma'am.
yes. Okay, so who's want to take the who want to take the second?
Can I do, Dr. Samar?
Samia? Samia?
Saima. Saima.
Saima. Okay. Saima, this is, I think it is two paper at least. Okay. Yes, start. If you finish the first paper, just let me know to give you the second one.
Next. Next, please. Okay.
It's okay
Hello,
for
I'm
you?
Dr. Saima.
Wait,
Previous slide. Can you show?
wait. Yeah, you can start now. Yes.
Can you show previous slide? Hello.
Hello. The
Hello,
first
I'm
one.
Dr. Saima, one of the doctor.
Yes.
Yes, yes.
Yes, start.
Hello, I'm Dr. Saima, one of the doctor in the clinic today. May I confirm your name and age, please?
Yeah, I'm Sarah Robert. I'm 23 years old.
What would you like me to call you?
Sarah.
Sarah. Sarah, I understand that you are here because you are having some tummy pain as well as some nausea. Am I right?
Yeah.
Okay. So, Sarah, as we are meeting for the first time, is it okay if I ask you a few questions to know more about you and then I discuss your plan?
Yes.
Okay. So, Sarah, can you tell me more about your problem?
This is planned pregnancy, and I happen to have this pregnancy. I'm waiting more than 2 years for this pregnancy. But in the last 2 weeks, I feel that there is abdominal. I'm not happy from it. There is a pain. There is discomfort, and I feel that there is a slightly bleeding. I have a nausea. Sometime when I asked the GP, he told me this is normal because of the pregnancy, and he gave me some medication, but it doesn't work. The nausea is just still. I feel the pain is increased a little bit, and the bleeding is more and more. And I don't know. He after that he referred me here. He takes some blood tests and urine from me, and he requests some scan, but I don't know anything about it. And I'm here today to know what happened. Is my pregnancy is okay? Is my baby is okay?
Okay. So, Sarah, I can understand it is difficult for you. Do you want me to call the nurse to give some painkiller, or you are okay? Can I discuss the management?
Um, yeah, I'm okay. I take
Okay.
paracetamol nowadays.
Okay.
Yes.
Okay. You took paracetamol.
Hmm.
Okay. So, Sarah, I want to ask few questions to know more about you. Do you have any allergies?
No,
And otherwise, you're fit and healthy. Or follow your GP for any medical problems?
no,
Any surgeries in the past?
no.
Okay. And I can understand from your this GP letter that previously you experienced one miscarriage. So can you tell me more about that?
Yeah, this is at the beginning when I married the first time. I have I have a pregnancy, and after that I lose a. But they don't tell me any cause behind this. It's once, and after that 2 years I tried to become a pregnant, but it failed. So this has happened, planned pregnancy, and it happened at the end. It's happened, but also maybe I will lose this baby
Uh,
because of these bleeding. So I'm scared from these.
Sarah, I'm very sorry to hear about that. That previously you had a miscarriage, but your ultrasound report is in front of me. I will be discussing your ultrasound report and your blood test. Do you want to join someone before I discuss the report? Because I will be giving you a lot of information, Sarah.
No, I'm alone. My partner is in the work, and he can't come. Is there any issue with this?
Sarah, I'm afraid I don't have good news for you. The I have confirmed the name as well as NHS number on the ultrasound report, and this report shows that you have an abnormal pregnancy, which we call as molar pregnancy. Have you ever heard about that?
No, what is that?
Okay, so Sarah, let me give you some information that normal pregnancy is developed from the eggs as well as the sperms, and both contribute equal chromosomes. That's why the baby is normal. Whereas in molar pregnancy, there is unequal distribution of genetic material from the egg or the sperms. Most of the time, the sperm meet with an empty egg. That's why this pregnancy is not normal and it can't grow further, and it is also important to end this pregnancy.
Yes, and 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 that means that the baby is not okay.
Yes, this baby is not okay, and you will need the small operation to end this pregnancy.
Oh my God. Yes, and when can we do
Sarah,
this?
Sarah, I can understand it must be very difficult news for you. I'm very sorry to be the bearer of this bad news.
Yeah, yeah. And
Are you okay to discuss further, my friend?
yeah, please, yes. I want to know what will happen next,
Oh,
please.
okay. So, Sarah, we have also done some blood test, and this show that your pregnancy hormone level is very high. So, we will be planning a small operation on your womb in which the pregnancy tissue will be removed. You will be just put to sleep, and it will be just a small operation, just like we do to end the pregnancy. Okay.
Mm.
And sometimes, because it is abnormal form of pregnancy, all the cells are not removed, and there are some chances about in 15% of the women, this pregnancy hormone does not come down after the operation. That's why we register all the women in a specialist center, which we call as trophoblastic center, so that we come to know which women this pregnancy hormone is not falling and which women need further treatment, because in some women it can develop into abnormal form, which we call as trophoblastic neoplasia. Have you ever heard, Sarah?
No, no.
Mm-hmm. Sarah, but don't worry, but just following you up, we are able to find if the level is not falling, then these about 15% of the women may need further treatment in the form of some medications or that kill the cells.
Yes.
Okay, okay.
Yeah.
So after the operation, we will register you, and if your pregnancy hormone calm down within 56 weeks, within 56 days of your operation, then your follow-up will be for the 6 months from the date of your operation. Okay.
Yes.
And if your pregnancy hormone does not come down within 56 days of your operation, your follow-up will be uh, 6 months after your pregnancy test has become normal. Am I clear, Sarah?
Yes, yes, I understand these, yes.
Okay. And do you have any question, Sarah?
Do you have any?
Any question, any query?
Yeah, I just wondering that when I can become pregnant after the operation.
Yes, Sarah, it is important that you don't become pregnant once your follow-up is complete. Okay, so once your follow-up is complete, then you can get pregnant. On the other hand, if you need further treatment, then we advise contraception for a period of 1 year, and it is advisable to use some condoms or barrier methods, and we don't advise this copper coil because it can cause hole in the womb. Okay.
Mhm.
And Sarah, I can see it blood group is negative. After this your operation, we will also be giving you anti-D injection so that you don't form any antibodies which can affect your pregnancy next time. Okay.
Uh-huh.
And Sarah, some more information I want to give that in the next pregnancy, most of the women have normal uh, babies, but there is slight increased chance, means you have about 1% chance that your next pregnancy can be molar, but 99% chances are there that you can have a normal baby. Okay, Sarah?
Yeah.
Okay.
So,
And suppose if we give you some injections called methotrexate, then it is recommended to don't get pregnant for the next 3 months.
mm-hmm.
Okay. And if you needed further treatment, then after the next pregnancy, when the next pregnancy will end, we will follow your beta HCG level after 6 weeks to know that you don't have developed the same condition. Am I clear, Sarah?
Yes, yes. Yeah.
Mm-hmm. Sarah, I can understand I have given you a lot of information. So I'm giving you this patient information leaflet, and I'm also writing back to your GP, and I will also involve my consultant. I will inform my consultant about your care, and we will
Okay.
okay? Okay, Sarah.
Okay. So,
Okay.
when we can start the
So,
treatment?
do you have any?
When can we
Okay.
start?
So, Sarah, we will be admitting you. Okay, and we will be doing some blood group and save, and this procedure will be done by the expert doctors. Okay.
Thank you.
Thank you.
Yeah. Um, brilliant, and you cover all the points. The introduction was amazing, and the history is a little bit shortened, but it's informative, which is okay. You give a breaking bad news in a very good way, and one shot, and after that, and you ask her to be calm, and if she's ready to hear you, it's very nice was. The explanation about the molar pregnancy, it is typical. Now, you mentioned the management. The management, you didn't mention the type of the operation. How is it? She must be admitted to the hospital, and they will remove by section. It must be mentioned this. You will be
Okay.
removed, okay, by section,
Okay.
and after that you will send it to the histopathology to see the type of the molar pregnancy,
Okay.
because there are different type, you know, partial and complete. You will not explain partial and complete because you don't have this time. The photo in front of you giving to you that it is complete. So you tell her according to the histopathology what is written to us. You must, until that time, you must register, and you say this, that register in the specialist center, the center which is present in London, Sheffield, and Dundee. Um, and according to the result of the histopathology, if it's partial, so we need to do a beta ECG, two time part weeks apart. Okay, so two time 4 weeks apart. And if it's negative, so that's mean she will no need any follow up, and she return to her normal life impartial. However, if it's complete, as you mentioned, it is 65 days. If she become negative within 65 days, so after 6 months, she will be reviewed again. However, if it not retained within 65 days, so she will be reviewed after 6 months from the normalization. Okay.
Okay.
Other than that, as you mentioned, she can use all types, all type of contraception. Only the only one she can't use it, it is the IUCD. Except in one occasion, if there is emergency contraception. This is for you, not for me. Okay, other than that, as you mentioned, that even so, the follow up, because there is a risk of complication that could happen, such as persistent vaginal bleeding, there is a tumor or carcinoma, or a second more could happen later on. Next pregnancy, most of the women have a normal pregnancy without complication. In the new guidelines, there is no need to do a beta SCG after next pregnancy if it's normal, and if there is no methotrexate or any chemotherapy use, so she don't need to use it. Otherwise, you cover most of the point. You said, I'm waiting you to say about the negative, and you mentioned the NTD, everything. But at the beginning, in these cases, also you must ask about if there is at or any time when you explain if there is a risk of bleeding. So do you have any objection, any blood transfusion? This is important
Okay.
question. In such
Okay.
cases, any cases with bleeding, need surgery, need with susceptible of bleeding, you must ask about the blood group and objection for blood transfusion. Otherwise, everything is okay. Okay.
Okay.
Uh,
Thank you.
Thank you for everything. Is there is any question, or is there is anything?
Uh,
Uh,
no, it is clear.
Wait. We have I don't know. Mustafa here.
Can I
Mustafa.
do the next case, Dr. Samar?
Uh, Shagufta, you did yesterday. If because I have request from some students
Okay,
who
okay,
have.
it's okay. It's all right.
So
It's all right, doctor.
no, Shagufta. If she didn't present, I will give you the next session. Okay, Mustafa, are you here? You want to do the second one? Okay, Shagufta, take the third one.
Okay.
You start the 2 minutes. Okay. Um, are you
Hello,
ready?
is this
Hello.
yeah. Hello, is this
Hello.
Catherine Mike?
Yes. Yeah.
Catherine, this is Dr. Shagupta, one of the doctors in the emergency today. Catherine, Catherine, if it would be okay if I ask my nurse to give you some something for your vomiting?
Yeah. Yes, please.
Okay. So what I'll do is I'll just ask my nurse to give you something for the vomiting so that you are relieved of the vomiting.
Thank you.
So Catherine, how are you feeling now?
I feel better.
Mm-hmm. Catherine, if you wish to, we can wait for some time so that you're feeling okay to continue with the conversation.
No, I'm okay now.
All right. So that Catherine, I can see from your notes that you're 9 weeks pregnant, and you've been having episodes of vomiting since about 3 weeks. Is that right?
Yes.
So can you tell me more about this vomiting?
From the beginning of a pregnancy.
Mm-hmm.
When I know that I'm pregnant, maybe 4 weeks ago, and until
Mm-hmm.
now, I have vomit. At the
Mm-hmm.
beginning, it's acceptable, but now, even the water, I throw it out. I feel
I'm
that
really sorry to know.
my weight, I feel that my weight is lost, and I lost
Mm-hmm.
my weight, and I'm tired from it. I'm
Mm-hmm.
very tired from this vomiting. I take many medication, but it doesn't
Mm-hmm.
work.
I'm really sorry to know, Catherine, that you've been suffering so much. So, Catherine, have you tried any treatment for this? Taken any treatment from anywhere?
Yeah, the GP gave me some medication, some tablets, but really it doesn't work.
Mm-hmm.
Yeah,
Mm-hmm.
I take
Okay.
what we call it cyclizine or something and med something, med glow. I don't remember exactly the names, but it doesn't work.
All right. Mm-hmm. Mm-hmm. And also, I can see that you've been passing a very small amount of urine since last night. Is that right?
I don't remember I go to toilet since night.
Mm-hmm.
Yes,
Mm-hmm. Mm-hmm. So
but I
basically,
feel
you've not been able to keep anything down, and you're
um,
passing really small amounts of pee. Is that right?
yeah, I
Any other problem?
yes. Any other? No,
Any,
just this
any other
vomiting.
problem
Keep
you?
me busy.
Yeah. So any other problem you have, like any fever or any flu-like illness?
No,
Mm-hmm. All right. And can you tell me more about this pregnancy, Catherine?
I want this pregnancy. I plan with my partner to have this pregnancy,
Mm-hmm.
and but from the pregnancy until now, I'm tired. Nothing more, just vomiting.
Mm-hmm. So this is a spontaneous pregnancy. Is that right?
Yeah.
And are you taking folic acid?
Can you take me for?
Are you taking folic acid?
Yeah.
Have you done any blood tests, any scans in this pregnancy?
No.
Mm-hmm. All right. And is this your first pregnancy or you've been pregnant before?
No. This is the first pregnancy.
This is your first pregnancy. Any medical condition you have?
No.
Any surgeries you've had before?
No.
Any allergies?
No.
Mm-hmm. And what about your weight height ratio? Are you aware of that?
It is 22.
22. And
Yeah.
your blood group?
It's B positive.
B positive. Any reservation for blood transfusion if required?
No.
Mm-hmm. All right. Okay. So, Catherine, I think going by your history, and also I have your urine report here with me, which was then done in the emergency. So, going by your history and also looking at your notes and seeing your urine test, you have most probably a condition called hyperemesis gravidarum. Have you ever heard of this?
No, what is this?
Mm-hmm. So this is a condition in which there is nausea and vomiting of pregnancy, and along with that there are some problem. I mean, you have problem keeping food down, and also there is loss of weight and some problem with your blood salts also. So this is called hyperemesis gravidarum.
Yeah.
So Catherine,
So
what we need to do is
it can be
we need to
stopped.
admit you.
Okay.
Yeah. So we need to admit you, and we'll be running more tests on you. We'll be doing a full blood count to check whether the thickness of your blood and your blood counts also. And also we will be doing what we call the serum electrolyte. And also what we are going to do is we are going to do your liver test and also your kidney test to know more about your general health. All right.
Mm. Yeah.
And we will also organize a scan for you to see how your pregnancy is doing. And in the meantime, what we are going to do is we will admit you and we will start you on IV fluid. That is, we are going to start a drip, IV drip through a drip in your arm.
Yes.
All right. And
Yeah.
because you've not been able to, the GP prescribed you certain oral medicines, but that didn't work. So we will be giving you these medicines through the IV route. That is through the drip in your arm.
Okay.
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 And
Yes.
we will also measure your this we will do your urine test, and we will check your level of dehydration every now and then, and also we will doing the serum electrolytes also. Hello, Catherine.
Hello. Yes. Yes.
So do you have any other concern that you would like to share with me today?
Uh, no, thank you. Uh,
Hmm. So what I'll do is I'll ask my nurse to start preparing your admission papers, and I will organize the blood test and the and urine test and also the ultrasound scan for you. And I will ask the nurse to start drip in your arm.
mm. Okay. Thank you.
Okay. Thank you.
Thank you. You have 2.5 minutes if you want to add anything, Shagufta. There's something missed.
Yeah, so I would just like to say that I could tell her that we will start you on the normal saline, and what we are going to do is we are going to put additional salts in each bag, and
Mm.
we will keep monitoring you. We will keep monitoring your blood to see how your salt levels are, and
Okay.
so because you've already tried the cyclism by mouth, and also you've tried the metoclopramide, so we can go for other medicines, and we can give you this metoclopramide by what we call the drip in your arm also.
Okay. Thank you.
Yeah.
Thank you. You have 1.5 minutes more. So you want to add anything, or I close the session and we will discuss the points. Close the session.
Mm,
Okay, that's it. That's it. Never
okay.
mind.
Thank you.
Okay, it's the introduction is okay. The history is fine. The starting for management, the explanation about the hyperemesis is okay. In the management, the important thing in the management, you discuss the investigation, which is brilliant, like urine analysis to see if there is any infection, and the glucose, electrolyte, a scan. You must do a scan to know if it's twin or if it's molar, if it's normal pregnancy, because she has hyperemesis, so most probably she's twin or moral pregnancy. So we must exclude these two. You admit her to the hospital, which is fine, and you give her medication by drip. You give her IV fluid to correct the dehydration that she has, and with that hyperemesis in the first trimester, don't forget to give her low molecular weight heparin. Okay, and
Yes, doctor.
yes, and stoking. This is pressure stoking. Also, it's important. Encourage her to move around because she's susceptible to have blood clot at any time. Also, because of this dehydration, and you will give her IV fluid, you must cover her with the thiamine to protect her from warning encephalopathy. This is the important thing for hyperemesis. The IV fluid, the medication, vitamin B6 and A, and low molecular weight heparin. Always we forget the low molecular weight heparin. It's important in this. And you tell her you can drink by mouth, okay, and encourage her after stop the vomiting and the nausea. She start to take a fluid from her mouth. Um, thank you. Is there is any question?
Thank you, Dr. Samar. That was an important point. I missed it. Thank
Yeah,
you.
yeah. Don't forget because the
Um,
hyperemesis
Ma'am,
in yes, the hyperemesis always when they bring the hyperemesis, they want to from you the low molecular weight heparin. Other than that, the hyperemesis mostly come with the results of the molar pregnancy. There is a case in the recalls. There is hyperemesis plus molar pregnancy. Okay, so always mention these. Always mention this in the scan. Is there is any a question?
Yeah,
Sorry.
Dr. Samar, in this, yeah, Dr. Samar, in this station, there is no need to ask about like habit, smoking, alcohol, what type of job you
No,
are doing, how
we must.
emotional, any
This is
psychological.
a normal history in all of these. She asked about the medication and others. You must take a full history. You must take a full history in every.
Full
Even
history.
you mention it.
Mm.
Yes.
Okay.
Even there is nothing. She will say no, 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 no. It will not take from you a time. Maybe she forget it, but in general, when they give a mark, they want the most important question. The other question, if they are missed, that's fine. In the abortion, for
Mm.
example, or recurrent abortion, you must ask about drug you abuse, because cocaine is one of the cause. Smoking is one of the cause. But here, because she has just hyperemesis and could be twin or could be molar, if she missed this point, it's okay. It will not take from her mark. But if she put them, that's okay. She will finish the. But Shagufta, today you take from the history around 5.5 minutes.
Actually, Dr. Samar, I thought that, I
Yeah,
mean, I
because I'm
didn't ask
vomit
her
at the
about all
beginning.
these
I
things
know.
because I thought
Yeah,
that she's in
I take it
emergency
from your
and,
time.
yeah, so.
I take it from your time. That's why I told you
And what
always
about
in the online, your eyes, keep your eyes on the time in front of you, because when you feel that the time go on, try to be faster and faster. Okay, so any question?
the examination? You will
Sorry.
mention
ma'am, I
examination,
have.
dehydration, any
Wait,
dryness.
Bara, you want to ask?
Yes.
Yes.
Sorry. For thromboprophylaxis, it need to be given routinely or if she's admitted in
What is it?
hyperemesis gravidarum.
What is it?
Uh, Thromboprophylaxis, a low molecular
No,
weight
only in
heparin.
admission. In admission.
Only on admission. If she's
Only in
admitted.
admission. Yes,
Yes.
this is طبعا severe. This is severe. She must
Okay.
admit it. She
Uh,
anuria. She don't have urine. It says it's
uh,
had no past urine and loss of weight. So this is indication
uh,
for admission.
okay. And if she's
Yes.
admitted, she need low molecular.
No
Thank you.
molecular weight heparin and stocking and vitamin B1 and 6. Falak, you have a question?
Yes, ma'am, I have a question. Ma'am,
Yes.
I was just thinking if we have to ask the questions that are included in the puke score also, like how many times she has vomited in the last 24. I was just asking if we
In this
could add
case,
to the
yes, you
history.
can ask all these questions. It can be asked because this is like assessment to the severity. But in the question, he said the condition
Okay.
worsen and can't keep anything down. So he
Okay.
this is a summarize, not to repeat this point again because he already mentioned it. But in
Okay, ma'am.
general, you
If
can ask.
like yes, like this is a case of hyperemesis gravidarum, we can figure it out from the history. But if we have a case of simple nausea and vomiting in pregnancy, in that case, should we calculate the puke score to get an
It will
idea
not
about
come in
we
the
need to
exam.
admit her or not?
It's
Okay,
not coming in
okay,
the
and
in the
okay,
exam
and ma'am,
it was admission or
yes.
associated with the molar pregnancy. So
Okay, and ma'am,
there
I
is
had
similar
one more.
case with the molar pregnancy, and you will discuss the molar pregnancy, both of them together. Okay,
Okay,
but if you
ma'am, one
want to do
more query
ultrasound,
I had.
yes,
Ma'am, I was just thinking if we could have offered her an examination to check if the size of the uterus is more, because it can be twin or it can be. Can we do it like? Can we
yes, of
say
course,
that we would like to
yeah,
examine you in the presence of a chaperone with your consent?
yes,
Okay, so we can do. Okay, ma'am. Thank you so much,
yeah.
ma'am. That's it.
Thank
Thank
you,
you.
thank you. Is there any question? Yeah. Okay. Oh, today I forget to record the session. Or we recorded? No, no, no. We recorded. That's good. Okay. Thank you all.